Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Srikar Karaman, who is a board-certified emergency medicine physician and the owner of Revamp Hormone Replacement and Weight Loss, a small business based out of the Appleton area that specializes in bioidentical hormone replacement therapies and both medical and natural weight loss solutions. After his residency was finished, Dr. Srikar embarked on a personal health transformation in which he lost over 40 pounds. Through that experience, he discovered that there is a significant amount of conflicting information that people oftentimes need to sift through when on a wellness journey, and he wanted to give people better support and information. So while continuing his work as an ER doctor, he established Revamp in February of 2024. Outside of work, Dr. Srikar considers himself a foodie and loves traveling, hiking, boating, snowmobiling, and camping with his wife and 2 dogs. We recommend listening to this 4-part series in order as the content covered in the episodes do build upon each other. With Dr. Srikar's expertise, we are excited to help you feel informed into the sometimes confusing worlds of hormones, PCOS, weight loss, and more. So let's jump into today's conversation.
Hey, welcome back to the podcast, everybody. We are back here with Dr. K. So we had talked all about hormones. We talked about hormone replacement therapy. We talked about the aging process. We talked about PCOS and cancer prevention in the last episode. A lot of information here. This last episode is going to be talking more about your expertise in weight loss. And so let's talk about that and how, the different types of things that you do with that, and even probably about like how hormones are incorporated into that too. So first of all, why do you think, because obviously weight loss is huge on people's minds, so why do you think like obesity and weight loss is such a big thing in today's society?
I think really the biggest one is because sugar is addicting.
Oh, yeah.
That's what it really comes down to, because it releases dopamine, it makes you feel good. So when you give somebody any mammal in this world sugar, they absolutely love it. Actually, there are quite a few studies that actually show it's more addicting than cigarettes, marijuana, and cocaine. You can get it as almost close to addicting as really heroin, which now becomes like hard drugs, right? Yeah. So that's really, I think, comes down to underlying is how addicting it really is, and it takes a lot of self-restraint. I mean, you walk into a cafe to just get a cup of coffee, but you got a whole display of cakes. Right. You're like, I'll crave some too.
Our society, sugar's in everything.
Oh, yeah.
I mean, it's in things that shouldn't, like they add sugar to applesauce. There's no reason for that.
Yeah, absolutely.
I mean, there's like, they put it in everything. So it's really hard to get away.
Add sugar to bread. I mean, there's really no reason that should be happening, but people, they do it because of how addicting it is. I mean, companies spend billions of dollars on figuring out what gets you addicted, right? They want you to go back to the same brand. So when you're fighting against that type of effort, it's really hard to resist.
Yeah, absolutely. So when we talk about weight loss, you specialize in medicated and non-medicated weight loss. So what's the difference?
Yeah, sure. So medicated weight loss is when we're talking about pharmacological components. So this is when we talk about GLP-1s like Ozempic, Wegovy, semaglutide, tirzepatide, and some of the older medications like phentermine. And then we can also work with a little bit like addiction of sugar itself with using naloxone, buprenorphine, propion. So some of the other medications as well. So that's more of a medicated weight loss is where we use medication as a tool. So this is not something that's standalone by itself because that will never work. It's a medication as a tool And then the non-medicated weight loss is essentially I work in the community with nutritionists, health coaches, physical trainers, personal trainers to really get like this holistic view and lifestyle change that may be appropriate for you. And it depends on one, your personal approach to life, and also how far you are from the goal post to really figure out what we need to do. Should we use medicated, non-medicated? And then most of the time ends up being a combination. But at the end of the day, everything is a tool, and we have to use the whole tool set to get to where we need to do.
You had a weight loss journey that we talked about in the first episode where you kind of shared your story. Did you use medicated, non-medicated solutions?
Yeah, so at that time, it's non-medicated. Because the medications on the market at that time had pretty significant side effects. So I did not want to deal with those side effects essentially personally. So I kind of went away so I did it non-medicated. But with the new medications, with the tirzepatide and semaglutide, the GLP-1 agonists, like the side effect profile is significantly better, and then people tend to do amazingly well on those.
I think that brings a lot of value to what you offer people because you have experience in losing weight the natural way, right? But you also have the background and the expertise to be able to support people who the medicated option might be better for them. So let's just start with, you mentioned GLP-1s. What are they and how do they work?
Sure. So GLP-1s, so initially it comes in with GLP-1, GLP-2. So those are hormones, kind of going back to hormones again, that's secreted by your stomach. So your stomach releases them when you eat food to tell your brain if you're full. That's essentially how it works. And when your brain gets a signal saying, oh, the stomach's full, then it suppresses your hunger. So like, for example, in the stomach, you have both mechanical and chemical stretch receptors. So mechanical receptors is when you like overeat in Thanksgiving and you're full, you can't move at all. That's more like a mechanical signal. Chemical signal is like, for example, if there's something really sweet, you take one bite, you're like, I don't want to eat that anymore, like I'm full. So that's not stretching the stomach, but that's sending your stomach signaling your brain that says, hey, we had enough calories for this meal, we're done, we don't want to eat anymore. So GLP-1s work on the chemicals. So basically, they give you early satiety. So basically that means they make you fuller earlier. It also tends to slow down how quickly your stomach empties out into the rest of your bowels. So there's more food that kind of sits around so you don't get the cravings that you get like middle of the day or cravings for a snack. So on the baseline, that's pretty much how they work.
So it really just helps people eat less.
Yeah, essentially, yeah. Essentially, the way they work is it lets people eat less. That's pretty much it.
And appetite suppression,
yep.
right?
Absolutely.
It's the mindset piece, because that's what I think what most people struggle with is it's like, oh, I just have these cravings and I have no willpower.
Well,
so it's the scientific side of the chemical response of how our stomachs and our brains are communicating related to food.
That's correct. Yeah, that's like a good way to really summarize it really well.
Yeah. And do you have there's also habits too. People deal with like, I just eat at night. I'm not hungry. Do you like talk with them about that? Is that education? Is that like awareness?
That's part of our consultation as well. We kind of look into their food habits and see how what they're doing. Because I have some people that tell me I just eat because I'm bored. There's nothing else to do. So I just, or like some people tell me I don't get hungry at all. I just constantly eat. I just don't get hungry.
It's just what I do.
Yeah, it's just what I do. So a lot of times it is, once again, it comes back to being the addiction. Like you have, even if you're not realizing it, you crave it. It's a comfort thing. It gets dopamine up and running in your brain. It gets a dopamine hit. And you almost have to kind of pull patients back a little bit from that.
Let's talk a little bit more about GLP-1s. So how can you get them?
Yeah. So GLP-1s right now, they've been on the market for really past 20 years. Initially, they were used for type 2 diabetics. Now, after within the last 5 years, once they got FDA approval to use in weight loss, we use a significantly higher doses than they do in diabetics. So we kind of know their side effect profile really well by now. How you get them is really two main ways. The first main way is you can get a prescription to get it brand name medication, like Wegovy or Ozempic, at the retail pharmacy. If your insurance covers it, then it's relatively more affordable. If your insurance does not cover it, you're spending about $1,500 per month on the medication. So it can get really pricey. And most insurances right now do not cover it because essentially your employer has to put in an obesity medicine rider on top of that, which costs more. So unless you have phenomenal insurance, most of the time they don't cover it. The other way you can get it is you can get it to compounding pharmacy. So the way the compounding pharmacies work is compounding pharmacies are used in pretty much everyday medicine, like a lot of oncological stuff is done by compounding pharmacies. And then a lot of medical creams that you want a particular dose, we send it to compounding pharmacy to get it compounded because they don't manufacture that in large amounts. So what compounding pharmacies do is these are all done at sterile compounding pharmacies, and they get the same medication that the brand name pharmacies get it from, and then they pretty much compound themselves. The reason it's allowed right now is because these medications are on shortage list. Usually, you're not allowed to compound them if there's a patent or trademark that's active. But if the medication is on shortage list, FDA says, well, you can't keep up with the demand or the need, so we will allow compounding pharmacies to come and meet that need. So that's how they kind of get around that. If the FDA ever says, hey, these medications are no longer on a shortage list and they're still under patent, the compounding pharmacies will have to stop immediately. One thing I would really want people to be aware of with the compounding pharmacies, they're excellent compounding pharmacies. They are regulated by Compounding Pharmacies of America, but there have been cases of contamination in the past. So when you go into compounding medications, ask your prescriber, because this is a prescription medication, is which pharmacy you're getting from and who are they regulated by, and if they have the regulation that they can easily access. So they should have certificate that says, hey, you're regulated to provide the prescription, either 501(b) or 501(a). So that's very important to know your source. Anybody that gets them from a quality source will be able to tell you that information very quickly.
So to kind of like back up a little bit, you had said GLP-1s are essentially hormones, okay, that are naturally created in our bodies. So are we talking about bioidentical hormone replacement again here of GLP-1s, or are we talking about this is a synthetic hormone replacement? Because this is essentially a hormone replacement option, correct?
Yeah, so right now this is essentially synthetic because they are synthetically manufactured. They're not derived from plant-based. Of course, they are, we can kind of talk about this a little bit as well. Some plants that kind of help secrete a little bit more GLP-1s than others, but it's pretty relatively minimal. So it won't move the needle one way or another unless you're eating a lot of it. And at that point, it's your mechanical receptors that tell you to stop eating, not the chemical receptors. So these are essentially synthetic at this point.
Okay, and then is someone taking this in a pill form?
So these are injectables. Because that has shown to be the best delivery system right now. They are working on oral medications for it, but it's been a challenge. Like Rybelsus is one that came out in oral, but it's the amount you absorb from your stomach is very low, so they have to take like a much higher dose of it because the stomach just breaks it down so quickly. And then other ways also delivery mechanism. Now it's kind of getting into the weeds. Is GLP-1s usually when your stomach secretes it only last for about a few minutes. Like they don't last in your body for a whole time. That's why you can sit for a little bit and then eat again because the receptor's done. So with the injectables, they kind of bind it with another chemical, essentially a peptide, that circulates in your system for a week at a time. So that's why injectables right now are the best way to do it. You inject it once a week, right? Essentially insulin needle. So it's pretty much like insulin once a week around your belly button, and it works really well.
Okay. So is this, doing natural weight loss, you said that you'll talk to somebody about the best option for them, but GLP-1s or it's the same thing as being basically, when we say medicated weight loss and GLP-1s, that's interchangeable.
Yeah.
Correct? That's what you're talking about using. Okay. So if you have somebody come to you looking for weight loss, how do you determine if GLP-1s are a good fit for them? Because I like to think that anybody who's on a weight loss journey could do the natural route. It's just that it takes a long time. So are GLP-1s typically used to help like kickstart the process or just help it go faster, or who is it for and who is it not for?
Sure. So when we do medicated weight loss, so GLP-1 is a part of it, but we have other tools as well. It depends on why you're overeating. So a lot of it kind of comes down to lifestyle. If you're overeating because you have an addiction for food, then that puts us like a different medication treatment plan. If you're overeating because you have what we call like a hunger noise, like something back your mind constantly telling me, oh, that looks good, eat it, or that looks great, or I'm craving this cake, or I'm craving this flavor. Those are excellent for GLP-1s because GLP-1s pretty much suppresses the food noise. I mean, it works phenomenally well. I have people that were able to go sober slowly under monitoring because they don't have the cravings anymore. So it has a lot of other things that really work well with it. But it also depends on how obese you are as well. So if your BMI is about 28 to 29, then I really push for more natural weight loss because you're so close to 25. Like we can just get you lifestyle changes, kind of get you over the hump. It saves you a lot of money, lets us avoid medications, kind of get you over that. But if your BMI is 30 or more, then we use this as another tool. It doesn't work by itself. You have to have a holistic approach, but we use another tool to really suppress the hunger part while you work on the rest of your lifestyle. Then we kind of address the hunger part once we get you to your goal.
So how long, I mean, obviously it depends on the person and what's going on, but typically how long would they be on a GLP-1 protocol?
Yeah, so that really, once again, it kind of depends on the person and why they're overeating or why they have gained weight. For example, I have most of my patients, they used to be really healthy when they were younger, kind of life got in the way with the family, and now they want to get their energy back and a lifestyle back. So for those, usually takes about 9 months or so, 9 to 12 months. We usually expect to lose about pound to pound and a half a week. Usually starts are really slow, but once we increase the dosage, it becomes a little bit faster. But at that point, once we get to goal weight, then we do a backward titration, basically kind of go back on the dose to make sure you can maintain it, because I don't want you to yo-yo. So for those, if people kind of do what our plan is, that we come together, that we make together, and they make the lifestyle changes. Some patients I was able to get off completely. So now they're no longer on the medications after they dropped about 40 to 45 pounds over the last 1 year period. Some patients we give like a little low dose like every other week or as they need it, like holidays are coming up. Some of our patients that haven't been on medication for past 3 months, we're going to do like a low dose so they don't overeat during Thanksgiving, or when they go on vacation, we do a little bit of that just to kind of prevent from overeating, and then they'll come back off it again. And some patients will have to be on it for the rest of their life if they want to maintain that. Once again, that all comes back to, do you have food noise? Are you addicted to sugar? What are lifestyles are you changes are you making? So it's very...
Maybe even like, what are you willing to do?
Exactly.
Like, are you willing to make all these lifestyle changes, or do you want, and of course it costs a lot of money too.
Yeah.
So
and then some people aren't willing to, and that's okay too. The reality is, the way we think about obesity has come pretty drastically from even just 10 years ago. Now we see obesity more as a psychiatric and a medical disease instead of willpower related.
Yeah.
So now it's kind of like I approach the same way. Hey, if someone has a high blood pressure, I'm going to recommend all these lifestyle changes, but I'm going to still treat the high blood pressure because I don't want them to have a stroke in the long term. So GLP-1s are approached the same way.
Okay, so if this is basically a type of medication, what are the side effects that they could potentially have, or maybe the pros or cons behind it?
The biggest side effect, the most common ones, are usually nausea and vomiting. That usually comes from people overeating. Once they start taking the medications, they think they can still eat the same amount, and they realize within the first day that they cannot do that. So like that's usually where it comes from. Some of the other side effects is if you have any history of medullary thyroid cancer, you can be on it. And then if you had any history of pancreatitis, then that's like a conversation that's a gray area. Diabetics, we had to watch closely because the sugar can drop pretty quickly because now they're not eating as much as they used to. So we got to monitor that very closely. And one of the really the big one is that when you drop this much weight very quickly, you can also lose muscle mass pretty quickly, because that's just how weight loss works. You always lose muscle mass. So we have to really do things to prevent that from happening.
And I'm assuming all of your programs, even people who are doing the medical weight loss side, you're trying to be very educational here about just lifestyle changes. And you're teaching them a lot of what you would teach your natural weight loss people, but obviously with this as an aid. Is that right?
That's correct. And this is a tool. Once again, I always tell them this is a tool. This is not an end all. This is not a solution. This is a tool. And even for natural weight loss, we can also do some natural supplements that can help get you optimize your weight loss as well. For example, like berberine is a big one. We get all our quality supplements as well from a reputable manufacturer. So like if you need insulin resistance or you just need to decrease a little bit, we can do natural stuff too.
Okay. Is this appropriate for kids? Because obesity in kids is rising as well.
It is actually approved for anybody over 12, I believe, 12 years of age. But with obesity in kids, you really need to find somebody that, a pediatrician that specializes in obesity, because you have way more other social compounding factors that come into play. And then the biology and physiology is a little bit different, especially when you're going through puberty. That's going to change quite a bit depending on how much adipose tissue you have. I think Children's in Milwaukee has an excellent obesity physician service or obesity medicine clinic that does wonders. But it is approved in kids, but you really need to find a physician that is versed and knows how to manage all of those.
Okay. Thank you for sharing all of this, because this was really enlightening. I feel like a lot of people have maybe heard of medical weight loss or GLP-1s, but they really have no idea what it meant. So this was very educational, but I do want to make sure we have a few minutes here to talk about the natural weight loss side. A lot of our audience is looking for natural ways to lose weight. So what are some of your top tips for weight loss, or how would you walk someone through a more natural weight loss program?
Yeah. So this is going to sound relatively generic because I'm just going to do overarching. So first one is food. So you got to see what you're eating. This is going to get a little nitty gritty. The best way to do is weigh your food, figure out how much macros you have, protein, carbs, and fat, how many calories you're consuming, and then keep track of that. Keeping track at the very beginning, at least for first 3 months, is going to be a game changer. After that, when you look at food, you can know, all right, this is how many macros you have, because you already kind of know, roughly estimate. So that's going to be the biggest one, is know what you're eating and what's in each food. So that's going to be the critical.
And that's something you can help with, right?
Absolutely.
Like you can help them. This is how many calories, this is how many macros, proteins, all that stuff, based on their lifestyle.
Yeah. So I do work with a lot of nutritional experts in the area, and they can really sit down and kind of get you all the details on how to track all of that. The second one is also, what other solutions do you have when you're hungry? So if you're going to eat out, you have to almost have like a pre-plan. Like if you're going to go to Culver's, okay, what can I eat there that's going to minimize the greasy food, but it's going to maximize the nutrition? Because the reality is life's busy and we got to find a solution for that. So that's really the next one. The third one is you have to have a whole family buy-in. When you cook 2 different meals of every single day, it's going to get old. And then let's say your spouse, significant other, your kids have completely different food lifestyle than yours. At some point, you're going to get tired and you're just going to pick off their plate. So you got to have a whole family buy-in. And if you don't, then you're not going to succeed. And the fourth one is really stay active. So it can be whatever makes you happy. So some people love cardio, some people love weightlifting, some people, even if it's just 30-minute natural, just walking outside with your spouse, that will make a huge difference. So just get a routine, a healthy routine. And then the biggest one that most people really ignore is sleep. You have to get normal amount of sleep. Some people need anywhere from 6 to 8 hours. It's a little bit different for everybody. But you kind of know when you had a good night's sleep, and you have to optimize that because when you're tired, your mental fortitude will naturally go down, and your inflammatory markers will go up, and then you'll just make poor decisions, and you don't have the emotional strength to resist. So sleep has to be really high up there, and you have to have a regular bedtime. Unfortunately, not everybody's schedules. I love that. Mine doesn't. So I completely understand that. But having that restful sleep will be a complete game changer for you.
I love that. Everybody listen to that. That's perfect.
Rewind, re-listen. Those are really great tips. What other professionals, you mentioned nutritionists in our area, but do you kind of link arms with any other types of professions to help give a well-rounded program?
Yeah, so I link, I work with personal trainers. So a lot of times I try to match patients with what they want to do with the personal trainer, because everyone does different things, and some trainers are experts at weightlifting and then building muscle. Some trainers are experts on burning energy and getting cardio in. So to make things successful, to optimize your lifestyle, I try to kind of match both the personality and some people don't want to go to the gym. Some people want to go to the gym. Some people want small groups. Some people want large groups. So I kind of work with everybody in the area to get you the right referrals for that. And then sometimes you may have nutritional challenges, like if you have food allergies, that you're like, hey, I have this list of food allergies, I'm gonna have anaphylaxis if I eat any of these. Then I kind of send you to like a nutritional coach, nutritional expert that can really sit down and help tease out these are the allergies, but these are the foods you can substitute for while getting the same type of nutritional evaluation. So those are the kind of like the big groups I work with.
Okay. I love that you have a balanced approach of being like, okay, let's take a holistic approach if we can. We have aids if we need them. You know, you're giving people options, which is great.
I think having the options is critical because you have to have the buy-in from you, and you have to have this, because it's not a 1 month deal, it's a lifestyle. Like it's the next 30, 40, 50 years of your life. So what are we going to do to get you set up to be successful in that aspect?
And you do a lot for your patients, but you don't do it all, right?
Yeah, exactly.
So not one of us is an expert at any one thing.
Yeah.
Right.
So a great place for people to get started, specifically when we're talking about the weight loss category, is that you are offering any of our listeners one free 3D body scan with accurate measurements. And we talked about that in episode number 1. So if you guys did not listen to that episode yet, go back and listen to what that body scan actually entails. It sounds pretty awesome. So you do get one free 3D body scan. How would people contact you if they want to learn more about your weight loss options, more about hormones in general, anything we talked about in these 4 episodes? Where can they contact you?
Yeah, the easiest way is to go on my website. It's Revamp, REVAMPHRT. So revampHRT.com. You click on the make an appointment button. The information on the contact us, it has my cell phone number and my email as well. So if you just want to, text or call, that's perfectly fine. Or if you want to email, that's perfectly fine. And then on the appointments, they're all free consultations. So all it takes is an hour for us to sit down and talk.
Awesome.
That's perfect. Yeah.
Thank you so much for what you're doing in our community. I love that you have both the heart to help still in the ER and help people locally that way, but then you're also branching out and helping with wellness. That's such a great balance. Thank you for sharing your knowledge, Dr. K.
Well, thanks for having me.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.